Thank you as always for watching OpenLine tonight on News Channel 5 Plus. Our topic tonight, children's mental health during the pandemic, which we could probably fill several hours of conversation with this tonight. But we are so thankful to have Dr. Tanguturi from the Vanderbilt University tonight. I have a article here on my desk that our producer pulled with the headline that says impact of COVID-19 on poor mental health in children and young people, quote, tip of the iceberg. I'm curious, as someone who's on the front line of this, is that a fair way to categorize it, that we're just now really exploring this and there's probably much more to learn from this?
Absolutely, yeah. I think, we know that the pandemic is going to have an impact on mental health, both in the short and the long term. And we are only now kind of starting to see some of those effects. And, I think it's upon all of us to kind of anticipate some of the longer term effects and make sure we kind of do the best we can to kind of protect against them.
I know we touched on this a little bit at the beginning of the show, but I think it's worth repeating, especially if people are just joining us tonight. What do you think are some of, maybe warning signs is the wrong word, but what are some signs that parents and grandparents can be on the lookout for if they're noticing some behavioral changes in their child?
Yeah, I think thinking about that in terms of like the developmental stage of the kid is going to be really important. Think about, let's say, toddlers, infants, preschool kids, if there are changes in kind of like, things like anxiety, things like increased tantrums, increased crying, sometimes a regression from like their previously kind of achieved kind of developmental milestones, lots of fears, lots of like, separation anxiety, not wanting to separate from caregivers. Those are all important things to think about in younger kids. And then for school age kids and adolescents, kind of thinking about things we talked about in terms of depression, signs and symptoms of depression, changes in mood, isolation, withdrawal, numbness, and changes in like things like anxiety and worries about kind of the future. Those are all kinds of things for caregivers to think about.
Something that I thought of as you were answering that, you mentioned at the top of the show that the volume that you've seen at Vanderbilt has only doubled as the pandemic has gone on. Do you feel like there are enough resources even within your field to be able to address this growing concern, as the article put, tip of the iceberg?
Not right now, but again, like I said, there is increasing recognition that we are in a crisis, and the hope is that with that, more resources kind of come into the picture, and we are able to kind of do better things.
Absolutely, absolutely. In the closing 2 minutes that we have, I'm curious if you could just kind of give us a little bit of a summary on what we've talked about tonight, and the fact that, just helpful things that if people just remember a few things from our conversation, they should keep in mind as they move forward, the kind of uncertainty that this pandemic brings.
I guess I would say 3 points. One, being aware that there are mental health effects of this pandemic that are especially more prominent in kids, children and adolescents, and we can all kind of do things to recognize them and bring them to attention. Number two, being able to kind of ask for the help, being able to kind of seek help from like qualified mental health providers, and being able to accept that help is going to be really important. And number three, really modeling healthy coping for children and adolescents, modeling healthy behaviors of dealing with these kind of like really stressful times is going to be key as well.
And to emphasize something that you just said there, it sounds like affirming that what the child is thinking is normal and okay and acceptable to be thinking about, right?
Yep, all of us are kind of going through the same feelings, and those feelings are normal.
Absolutely. Absolutely. Well, we have only about 30 seconds left, so I just wanted to end this by saying thank you so much for all of your time tonight. I know you're a busy guy, so for you to commit so much of your time tonight to have this conversation, I think it's been incredibly helpful. And just one final word from you. If people are looking for more resources, where would be a good place to look for them?
The websites for the American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry. There are multiple hotlines.
And we're going to have to let that be the final word. I'm so sorry we're out of time. We'll be back after this.